Hello, everybody. Let's learn the clinical reasoning by looking at the cases and digging deep into the most possible diagnosis, and at the same time, having a look at the other possible differential diagnosis. So, let's get started. In the second case, we have a 28-year-old gravidavan paravan woman who comes at 4 weeks postpartum visit. She tearfully describes being exhausted and unable to return to sleep after getting up in the middle of the night. She gave up the breastfeeding because, according to her, the baby was fuzzy and she was afraid she wasn't getting enough to eat. She has little time to care for herself and the baby, is increasingly depressed, and has little energy. She exclaims, "I don't deserve to be a good mother." Past medical history is not significant and physical examination is normal. Her labs, hemoglobin and TSH are also normal. So the question is, what is the next step in the management? So think of the diagnosis and we shall next come to the next possible step in the management. As most of us might have already concluded, the diagnosis is postpartum depression, and we start the patient on SSRI in case of postpartum depression. Now, what is postpartum depression? It is the depression that is seen in women after the childbirth, and signs and symptoms of postpartum depression include depressed mood, insomnia, appetite disturbance, low energy, and feelings of worthlessness. The time of presentation is typically within 4 to 6 weeks after the childbirth. It can be up to 1 year as well. The treatment includes SSRI, which is the first line, and it should be sertraline in a breastfeeding women. Now, the first differential diagnosis that we should think about is a postpartum blues. Postpartum blues are normal, self-limited condition characterized by mild depressive symptoms such as tearfulness, irritability, dysphoria, anxiety, insomnia, and impaired concentration. The time of presentation peaks at 5 days and resolved by 2 weeks after the childbirth. So, the main point to keep in mind about the postpartum pathologies is the time of presentation. In postpartum depression, as we saw, it is within 4 to 6 weeks of childbirth, and in postpartum blues, it peaks at 5 days and it is usually resolved by 2 weeks. The treatment for postpartum blues is reassurance and monitoring. We do not give any pharmacological treatment on postpartum blues. The second differential diagnosis to keep in mind is postpartum psychosis. It is characterized by delusions, hallucinations, thought disorganization, and bizarre behavior. The time of presentation here is variable. It may be from days to weeks. The treatment for postpartum psychosis is something that is to be kept in mind. They include antipsychotics and antidepressants as well as mood stabilizers. The one thing that is to be highlighted is do not leave the mother alone with infant due to the risk of infanticide. So please like, share and comment on this video if you found this useful. And don't forget to subscribe my channel for updates on further videos of clinical reasoning. Thank you.